The Obama administration is appealing a Florida judge's ruling that the health care overhaul law is unconstitutional. The judge's decision was made because of the coverage mandate. But many other people have problems dealing with the math in that law. White House correspondent Wendell Goler reports on a huge discrepancy over how Democrats and Republicans interpret some of the numbers.
Republicans trying to roll back President Obama's health care law are challenging his contention that doing so would raise the budget deficit. In an op-ed on FoxNews.com, Wyoming Senator John Barrasso said a year under the law has revealed, quote, broken promises and unhappy Americans. And in an interview, he challenged the Congressional Budget Office finding that the law would save more than $100 billion over the next 10 years.
The Congressional Budget Office, by law, has to score whatever they're given. So if there's some wild assessment or assumption that everyone knows isn't true, they still have to count that.
The Congressional Budget Office is the nonpartisan scorekeeper for the cost of federal programs. Barrasso says he doesn't want to change that. Paul Vandewater once worked for the CBO. He says if there's one thing it's good at, it's arithmetic.
Republicans, including most recently Speaker Boehner, are proposing cuts in Social Security benefits, which they say would both extend the life of the Social Security Trust Fund and also reduce the federal budget deficit. They don't call that double counting either.
White House critics say Health and Human Services Secretary Kathleen Sebelius all but admitted to double counting $500 billion in Medicare savings in last week's budget hearings.
Is it using it to save Medicare, or are you using it to fund health care reform? Which one?
Both.
The gentleman. So you're double counting. I yield back my time.
Privately, administration officials say Sebelius wasn't given time to explain that not all of the savings from reducing Medicare payments to insurance companies are being spent on other health care. In an interview with our Bret Baier shortly before the bill was signed into law, the president said the difference extends the life of the trust fund, even if it doesn't create a surplus.
Your chief actuary for Medicare said this, that cuts in Medicare, quote, cannot be simultaneously used to finance other federal outlays and extend the trust fund. That's your guy.
No, and what is absolutely true is that this will not solve our whole Medicare problem. We're still going to have to fix Medicare over the long term.
It will take a long-term fix of Medicare and Social Security to bring the budget deficit under control. The President's Deficit Commission has recommended such a fix, but lawmakers from both parties and the White House have basically turned their backs on it. Brett?
Wendell Goler live on the North Lawn. Wendell, thank you. Now